First, is the baby's crying within normal limits, and are there any jitteriness or tremors? Check the skin color. Is it within normal limits? And the condition of the skin. Is there any lanugo present, or milia, stork bite, vernix? Note if there's a lot of vernix or vernix in just creases. Check the head for any bruising, caput, cephalohematoma. Check if the posterior fontanelle and the anterior fontanelle are open or closed. Check the sutures for overriding or separating. Check if the nose is patent by holding one nostril and watching for the other one to suction in, or if it doesn't, it's normal. Is the nose symmetrical? Check to see if the ear canals are open. Are the ears positioned within normal limits? Trace a line from the corner of the eye to the top of the ear. Check the eyes for any discharge or lid edema. And then, is the position of the eyes normal? You should be able to fit one eye between the two eyes. You're going to check the mouth and lips to see if they're within normal limits. You're looking for a cleft lip. You're going to check the palate to make sure it's intact. Check for a lip tie and tongue tie. You can at this point insert a gloved finger into the infant's mouth and check if their suction reflex is there. And at that same time, you can see if they have weak or strong suction. And if you notice any issues like clicking, that could be signs of a tongue tie. You're going to check and make sure the clavicles are smooth and that the neck has normal mobility. You're going to palpate the breast buds for any edema. Check that the nipples are symmetrical and normal placement. Then you're going to palpate the abdomen for any palpable masses, and then listen for bowel sounds. You're going to check the umbilical cord, make sure there's 3-vessel cord. Note the number of vessels on the newborn exam, and is the condition of it within normal limits. You're going to listen to the lungs, auscultate to determine if they are clear, if there are any rales, rhonchi, grunting, or retractions present, and if the cry is abnormal. Then you're going to listen to the heart for rhythm and rate. And at that point, you can take note of the heart rate. You can also go ahead and get your respiratory rate when you're auscultating the lungs. And then you're going to check the temporal pulses by feeling here, the brachial pulses here, and the femoral pulses here on both sides. Then you're going to look at the hands, see if the creases are within normal limits. Note that there is a normal shape or taper, and then count each of the fingers. Make sure there are 10. In this case, there are not. Now you're going to check the range of motion of all the extremities, and when you do the legs, you're going to listen for any pops or clicks. You're going to check muscle tone, whether or not it's within normal limits. And then you'll examine the genitalia. For girls, you're going to look at the labia, make sure that the urethra is in a normal place and that the vaginal orifice is open. For males, you're going to check their foreskin and where the medial slit is at. You want it located at the tip of the penis, nowhere else. Then you're going to check the scrotum to see if it's within normal limits, and then if the testes have descended, you'll just palpate. If they're not descended, you'll find them kind of up here on either side. Then you're going to flip the baby over and check that their spine is closed with no dimples, straight and symmetrical, and note if there's any Mongolian spot. At this point, it's a good time to go ahead and check the stepping reflex before flipping the baby back over onto their back to minimize disruptions. So then you're going to check the anus, which you can also do while baby's flipped over. I like to get them back onto their backs so they're nice and cozy. You're going to make sure that the anus is patent, make note of any fissures, if any, and that there's a normal location. Then you'll check the rest of the reflexes, the root suck, the moro, which is startle reflex, which you'll probably go ahead and see when you flip the baby back over onto their back from doing the stepping reflex. Check the blink reflex, the palmar grasp, and then you'll check Babinski and plantar by starting at the bottom, watching for the curl and the extension, or the extension, then the curl. And then you'll already have your stepping reflex if you did that earlier. Then you'll do the pre and post ductal SpO2. You can check that at 2 hours, and then again at the 24-hour visit. At that point in the newborn exam, you'll go ahead and get a head measurement, chest measurement, and abdomen measurement, and then you will get the length of the baby and the weight of the baby, and you're all done.